Wonderful. Yeah, we are very excited. I know that the team I've been working with, the Know How Center and First Steps Foundation, of just like, what does it look like to create collective action here? And it looks like sharing what we got. And I recognize that in the orphan care space or the vulnerable child space, is that nobody's going to have the one solution to the problems we're facing. But when we're able to link arms, that unity creates strength. And that's what we're trying to accomplish here today. Um, as we prep, I would just like to give a brief introduction of a Child's Hope Foundation and why we're doing this. We exist to eliminate isolation in orphan care. We desire to elevate the way the world cares for orphans and vulnerable children, and we do that by connecting everyone in the sector to the support they need. What that means in this context is bringing people to the table. We want to have conversations with subject matter experts and people who have big brains and big hearts to talk about this. So what you can expect from today's conversation is a wonderful presentation from Antonetta, and then they will talk a little bit, and then we'll have like conversation after that to be like, okay, Tony said some really wonderful things. How do we feel about it? What do we do with it? And that's where we'll go. Before we launch, any questions at this point?
Nope.
Awesome. I think it'd actually be beneficial too. In the chat, would you mind dropping the link to your own organization if you have one, or your LinkedIn or something? That way we have almost like a chronicle of people's content in agencies. With that, I want to say a big thank you to Heidi Jensen from the First Steps Foundation for helping us out in leading and figuring out how do we do this in Bulgaria. That's been so helpful. And then also to Elita and Antonetta for providing wonderful content that we're excited to share and digest together. So with that, Antonetta, would you mind jumping in? Share a little bit about yourself, about the Know How Center, and then take it away from there.
Yeah, thank you. My name is Antoaneta Mateva. I'm from Sofia, Bulgaria, and I'm clinical social worker and also a doctor in psychosocial studies to the University of the West of England in Bristol. My main work is related to the Know How Center for Alternative Care for Children. That is part of New Bulgarian University in Sofia. And this research center is established in relation to the policy of deinstitutionalization of big homes for children that were called of orphanages, but actually a lot of children there have their parents. And it was big rush and big effort, especially from the European Union, to close these big homes and to develop alternative care services where children live. So the Know-How Center was established to as academic institution to make research on the policies and the process of policies and the practices that are accompanying this kind of deinstitutionalization process. Of course, with other organizations, mainly non-governmental organizations, that created a coalition. I will start with the presentation and shortly will describe this kind of coalition and how the research was initiated. I will now share the presentation.
Awesome. Thank you, Tony. I'm so excited.
So the main topic is reasons for separation of children and families in Bulgaria. This is a study of the experience of members of this organization called Coalition Childhood 2025. Because it was called this way because the coalition was related also to the process of deinstitutionalization, and coalition, the plan of the policy was that this deinstitutionalization process will finish this year in 2025. That's why we reached this year here. But in order to think about this kind of processes and the topic that the study covered, I want to start with some definitions. And we have two main concepts here: institutionalism and deinstitutionalization. Of course, institutions are very important in our governments because they are devoted to the process of serving different needs of the society. That's why we have different institutions to resolve different problems. But during and after the two big wars in Europe, we found that a lot of people left alone in their destiny after the wars, and they needed some place where to have some warmth and some food. That's why children that left orphans after the wars, or some people with disabilities, were sent to big institutions, because institutions of care follow the model of hospitals. And you know that big hospitals have these big rooms with a lot of beds, and with the similar dresses that you wear when classically in our hospitals we go and to be cured. And it was very important thing to have this kind of institutions of care because they help a lot of people to survive. But during the years, especially in the second part of the 20th century, when the attention of the science was on neurogenetics, on human behavior, and care, how we care for children, especially, this kind of research found that there is dehumanizing part of this institutional care. And this dehumanizing part is that everything was given with the ethics of justice. It means that for each child, the same. For each child, we can provide the same necessary food, dresses, and everything. And it was not very just because you know that different people have different needs, and we have to care for serving specific needs of each individual child. It was not possible in massive institutions where 200 or 300 children lived together. It was not possible because the staff was very small, and the science realized that we have to have for each child and each child mind specific adult who gives his mind to the child in order to grow. This is called key adult. Each of us who grow in a family know that we have these special adults, these parents that gave a lot of care to us, a lot of their mind, of their vision, of their attitudes, and we accepted them in order to grow. That's why this kind of research that was done found that the big institutions are not good for child's care and child development. And they have to live in the society, and their individual needs to be faced in a right way. That's why we spoke about the institutionalization and alternative care for children. This was just to be sure that we are speaking about the same thing. And I will introduce also the frame, or the legal frame that calls what is child at risk in Bulgaria. We have this child protection law accepted in 2000, in year 2000. where there are 4 categories of children that are called children at risk. First category is child whose parents are deceased, unknown, deprived of parental rights, or whose parental rights are restricted, or the child is left without their care. It means that generally children are left physically without parents. The second category presents children whose parents are present, but they don't perform their parental role in the right way. That's why this is child is at risk when it's a victim. He is a victim of abuse, violence, exploitation, or any other inhuman or degrading treatment within or outside his or her family. This is mainly children, the category of children victims of different types of violence and neglect. The third category is when child is at certain risk of harm, physical, mental, moral, intellectual, or social development risk, but this risk is temporary, and this is not a very serious risk, but risk that could be prevented. Child at risk of dropping out from school or who has dropped out from school is a new category that the law also included, because to leave the school, to not go to school, is also huge risk for socialization of the children. In the system of education, we have law, preschool and school education law, accepted 2016, in which last edition in 2024, we accepted the same definition of categories of children at risk, because specific reforms started in educational system also, in which a huge effort is made children at risk to be recognized by the school people. And if there is this kind of risk, they have to be able to recognize this risk and to connect to the child protection system and to be part of this system. So I will tell you shortly about the methodology, but before that, want to present briefly Childhood 2025 Coalition. This is informal association of 16 civil organizations, networks, and individuals with expertise in childcare. Of course, this coalition was established in 2010 when this process of the institutionalization of childcare started in Bulgaria. And its mission is to overcome the institutional thinking. I emphasize thinking because first idea was that we just will move children from the big institution to the smaller one. These small institutions of care are, of course, in the cities, not in the mountains as before. But still, it's not enough, because if the staff doesn't change their thinking and doesn't individualize the work with the children, it's still institutional. That's why this is first mission. And the second is to support children at risk and their families, to create alternative care, to create some services in the community, and to work with the children and with the parents. The purpose is, the current purpose, when almost the process of deinstitutionalization and covering of the big institution is to its end. Now we have another topic to work on, and this is prevention. Prevention in any stage of the work with the children, prevention of the general risks for the family, in order separation not to happen to them. that's why we decided to see what is the situation at the end of this stage of the deinstitutionalization process, and to explore this through the specialists in these social services offered by 7 of these coalition partners. Here are the names of these coalition partners. Know-how Center is one that organized generally the summary of this exploration, but with the very important work locally of all other enlisted here organizations. Equilibrium Association that worked in the city of Ruse, For Our Children Foundation working in Sofia, Hope and Homes Bulgaria branch, International Social Service Bulgaria branch, SOS Child Villages Bulgaria branch, and Tulip Foundation. These are the actors, the experts of the research who collected the data. What we actually studied? We studied the process of separation and prevention of separation made by alternative care services. And these services are only services of the coalition. We started with the services of this coalition and the experience of members of the coalition. We included 5 areas of exploration. First, we wanted to know what are the reasons that led the child protection system to separate the child from its family. The second is what is the impact of separation on children and families as the act of separation happened. The third one is what happens when this measure of protection is set on. What kind of procedures, what kind of approaches, what kind of evaluation is made when the child is separated from the family, how the system works with the child and with the parents and the community. After that, we wanted to know what are the professionals' attitudes towards separation as a whole and about its prevention. And of course, we finished with some recommendations from the specialists. So here, the data present the voices of the specialists about the position and their positions about separation process. A study period is from November 2023 to November 2024. The scope of data is for 5 years, and this is from 2019 to 2023. We collected data from 19 of the 28 country regions because different services are situated in different places in Bulgaria. And we collected more than 1,500 cases and colleagues analyzed these cases in order to see what kind of situation happened, what are the reasons, and how this case were evaluated by the child protection system. We made survey with 52 people and focus groups with 226 people. I have to mention, in order to validate the results, we, after making some focus groups and surveys with the specialists in the coalition, we decided to have focus groups in in 6 different regions in the country with people that are professionals in the same field of child protection, but not part of the coalition. That's why we have so many people with the focus groups. In order to, we presented to them our results, validated this result with them, and edited some of the data according to their responses too. Some short statistics. Here you can see number of the signals in the red through the years. number of the signals received by child protection departments in Bulgaria. This is general statistic sent by Ministry of Labor and Social Support. And you can see how much of them were actually evaluated as children at risk. This is the blue line. We can see what is the rate of the risks that were evaluated. I will not comment this, just show this. And also we have here the number of children placed in alternative care. After being evaluated, you can see here, for instance, for 2023, we have separated from their families 1,959 children, but all children at risk were 7,519. So we can compare this data, how much of the children were separated. A little bit more statistics. During our research, we found the main reasons why children are separated by the system, we include here also decisions taken by parents to left their children, not only separated because of the system, but also children that were left to the system by their parents. You can see here that the bigger number of cases of separation are because of the poverty and unemployment, and also because of the illness and disability of parents. Here I included mental disabilities, psychic disabilities, and also some physical disabilities, but huge number of the mental disabilities and addictions also of the parents. We see this, and it's interesting that according to the specialist, most of the reasons are very complex, and they need very complex and collaborative decision to be taken, and especially locally. Local municipalities have to take care for this poverty and unemployment, and for children and parents with disabilities, because this is a huge problem. Healthcare system have to be included here, and other parts of the Ministry of Labor and Social Support have to be included in order to prevent separation of children. I will not discuss all this data about the other reasons. You can see them. You can have this presentation also present to you. Here we wanted to compare what parents tell about the reasons why their children are separated by them. We asked actually specialist, this is specialist voice about what parents says usually as a reason. And you can see that again, poverty and unemployment is the huge problem for these children and these parents, who usually suffer from very complex difficulties, not only one or two things, but combination of many and different reasons here leads family to the situation of separation of children. So I will show in this presentation. I want to see the time, how much I have. Several conclusions that we had, because actually we evaluated the entire system of child protection, and the results are very rich. We will share the link in which you can see in the know-how center the entire report. Unfortunately, till now it's in Bulgarian because it's very fresh, prepared very soon, but we will translate this also in English. First conclusion is that usually separation happens when there is a crisis situation, an emergency of the situation that the child have to be immediately withdraw from its family, or his or her family, and usually it's brought to family center, foster family, or kinship care. This is problem, and the problem is that there is no time for preparation of child and his family for separation. And this is a serious problem because children and parents suffer a lot, and they resist a lot when someone comes and just takes the child from the family. It's traumatic situation. That's why we made this conclusion that it's important to have some preparation, to have some work after that with the parents and the children when child is separated from the family. The second conclusion we made that children and their parents experience the process of separation as a traumatic event. They perceive it more as a method of sanction than a support. And professionals know this very well. They agree that this is a very traumatic event. We evaluated short-term and long-term experience of children and families, and we saw that in the long-term experience, children experience varies, and there are some positive effects of this separation, but also a lot of negative effects. The positive effects are related to these children that lived in very bad situation, in a huge poverty, no water, no food, no roof even. Children valued the new places where they are situated. They start to grow better, but still they emotionally suffer from the separation from their parents. That's why some of the alternative services support parents and children to stay together and to have positive image of the child and positive image of the parents. This is very important. When it happens, when and where it happens, it a little bit eliminates this traumatic event that happened in the first situation of separation. But this is not explored. This kind of good practices are not explored and not described. There is no methodology how to do this. And different services, because of their professionals' wish and will to support children and parents, they develop such kind of practices. That's why one of our recommendations is to collect and explore thoroughly this kind of good practices of work on the separation process that is developed by different services, and to create methodology on it. The third conclusion is that we found through the description of the professionals that there are three categories of parents. Three categories of parents' response to separation. The first, this is they pull themselves together, they organize themselves, they mobilize themselves, and start changing their situation in order to take back their children at home. this is the more active part of parents, but this is the ideal part of parents that collaborate, support the process, actively do things, and listen to the advices of the services. Unfortunately, there are two other groups of responses to this separation, and parents stay passive. They accept this like punishment, they accept this like something that is for the best of the child, because they have nothing to give to this child. That's why they agree the child to stay in institution. And the third one is they become aggressive and refuse to cooperate at all to the services. The problem with this is that some of the attitudes of professionals are that they better not work with this second and third category because they are not motivated. This is the reason. And we have to work on this attitude of professionals, because we know that these involuntary clients are the most important clients of the social services, because it's easy to work with motivated people, but for different reasons, these people also suffer from this separation and react in a different way, just passively or aggressively. And we have to recognize this and to take care for them too. In other way, it's discrimination. I cited here in blue what one of our colleagues said from Equilibrium Association. Each parent, despite his or her origin, ethnicity, cultural diversities, economic and social status, wants the best for his or her children. So if we start with this thinking, we will be positively, we will react positively to each of the reactions of the parents. Conclusion 4, there is a lot of expertise available. We found that different alternative care services developed a range of instruments. A lot of experience were shared through the cases and through vignettes. In this report, you can see them, how they try to prevent these situations of separation. And what is needed now is to collect this all experience and instruments and methodologies, evaluate them, and develop some common standards, how to prevent such kind of cases, how to inform children and parents in appropriate way when they separated, how to support families when their children are out of the family. Because we found that this bureaucratic approach sometimes left family to decide alone to connect to the child in the institution or not to connect to it. If, for instance, there is this kind of rule that when the child is separated and is put in institution, the parents have to go and sign a document that they want to connect to the child during this process of separation. But some of them don't know about this document even. Some of them are not illiterate, are illiterate and couldn't write. So this is not the right way to wait for the family to decide want or not want to come to the institution and to see the child. We have this kind of details that we mentioned in the document, but generally we have to collect positive experience and examples and methodologies, and to create common standards for this. Conclusion 5. There is this kind of problem of collaboration, and this is inside the system between the child protection department and also with the system with other systems, collaboration between institutions locally, and also on ministerial level. We recommend much more collaboration, much more meetings on individual casework than it's done now. Usually it's done bureaucratic, sending some documents from each one department to the other, but it's not enough. Because of that, we have not much information. When the child comes to the alternative care service, you have to search for a lot of information because there is not enough information about the previous movement of this child from the family, how much it was, where it was sent, and we have not the story of the child. This is a big problem in Bulgarian system. Conclusion sixth, develop procedure, support for the family, and data collection. Because families are not supported enough, we think that they have to develop on the ministerial level, there have to be developed standard for this. We have not data collection and analysis of this data generally. Ministry collects a lot of data, but we found that they are not analyzed and they are not used for the change of the policy and practices. So a lot of data are collected, but they are collected just to control the services, not to learn from this data. And this is end of our presentation. Here we mentioned some other resources that other organizations in Bulgaria generally develop, and we will be thankful if you give our feedback. We will leave this to Child Hope, of course, to collect your feedbacks about this conversation, about this presentation and the conversation that follows. Thank you very much.
Dr. Tony, thank you so much. That was fascinating and like encouraging that y'all have created a body of literature or added to the body of literature that suggests like this is the most effective way to intervene or what is necessary and what already exists. It's discouraging because it is still a mountain to climb, but we don't climb it alone. So thank you for that. Before we break up into breakout rooms, there will be 2 breakout rooms and we'll put people into those. I wanted to give you a second to, in the chat, just write down something that you are thinking about. Perhaps it's a question or a concept that Dr. Tony had shared with us. So go ahead and do that right now, and that'll kind of prime the pump as we are about to jump into those breakout rooms. Tony will be in one of them and Alitza will be in another, and so you'll have some representatives from the Know-How Center to kind of facilitate that conversation. Yeah, so take a second or two, write down in the chat something that's standing out to you now. Oh, that's good. Thanks, Heidi. Thanks, Deborah. And something that we'll do on our side at A Child's Hope is synthesize some of these comments and questions afterwards, and then make sure that they're represented in the follow-up email that we'll send, which the follow-up email will have the recording to this event, and if it's all right with Tony, the presentation slideshow. Yeah. Same, Molly. Yeah. Kevin and Anna, like what you're saying, like I thought like we were doing the best we could, and still it's dehumanizing, and so now let's do better. That method. Yeah. So if you still have thoughts that you're posting in the chat, feel free. The prompt that I want to leave you with as you're going into these breakout rooms is, how similar or different is your experience working in orphan care in Bulgaria or in your respective location to what was shared by Dr. Tony? So, talking about similarities or differences based on the content provided. We're going to go ahead and open up these conversations. We'll put you in those groups for about 8 to 9 minutes. Sydney, let's try to bring them back at 53. So we'll see you in a bit. You'll be invited soon, if not right now, to join your breakout room. You're talking about similarities and differences of your experience in orphan care. Yeah, I really enjoyed my breakout group. It felt like we could have had a longer conversation over a nice Bulgarian meal, and that would have been much preferred. But we take what we can get here. As you're back, I'd love to hear from a couple of you from your breakout rooms. What was one thing that stood out, whether it was something you said or something one of your colleagues or your friends here said? Yeah, just a little bit of feedback. How did those breakout groups go? What did you talk about?
Well, I love the fact that what Annetta had to say about the fact that difficult situations are always going to exist, but the goal is to allow a family to move through that situation together, because the outcome is going to be much better for the child in particular, but also, of course, for the family, especially for parents who were previously passive or aggressive or passive aggressive in the past, right? That if they can see, okay, I have the power to make decisions that are going to affect myself and my children positively, then that's very beneficial. That'll help the entire situation get better and grow. So thank you, Annetta. That was great.
Well said.
May I make 3 points?
Please, David.
First one, poverty and unemployment was mentioned as one of the principal reasons for separation. A few years ago, the World Bank assisted the National Institute of Statistics in Bulgaria in making a poverty map of the country, actually highlighting the poverty hotspots, both on a regional basis and in terms of districts in some of the bigger cities. And that enabled me and my colleagues to look at those hotspots and compare them to the geographical dispersal of essential services. And the lack of correspondence was quite significant. So geographically, at least, services are not well embodied in the community. Then Antoinetta suggested that one of the main triggers of separation is family crisis.
Yeah.
And as a service provider, I will say that our organisation often finds that families are referred to us for assistance at too late a point for us to really effectively respond. The crisis has already happened, things need to be done really, really quickly, and it suggests that the current emphasis on early intervention and prevention simply isn't doing the right job. We would like to see a lot more collaboration between social services providers, nurseries, kindergartens, schools, general practitioners in the medical services, so that we're picking up families at risk at a far earlier level, earlier point.
That sort of prevention is always better than firefighting. Is that, from what you're saying, that's what's happening?
That's precisely what I'm saying, yes.
Firefight, yeah.
Mm-hmm.
Yeah. Deborah, I saw you wanted to comment. Please.
Yeah, I apologize. I didn't mean to interrupt. I don't see where I can raise my hand on the little emoji thing. Sorry. I had a question for David. Or anybody, what percentage of these cases are from Roma families typically? Like Romas living in villages?
There is no such kind of statistics. There is no such kind of statistic because it's forbidden to separate in the statistics Roma.
That type of analysis is forbidden by the government because it seemed to be discriminatory.
Yes.
Having said that, as a service provider, we would say that Roma are disproportionately represented among our clientele.
Yes. Yes.
Yes, and I totally agree with what you both are saying, and if I may point you to this second study that we have in the presentation, which you will get, there has been a report specifically on that subject, on the disproportionate number of Roma children that are placed in alternative care, and there are some very interesting statistics, and it's in English also, so it will be in the presentation that you will get from us, and you can see some data in there.
Okay, because it seems like it would be needful to have a particular approach taking in mind their culture. Yeah. So that it could be adapted for their culture. So it seems like it would be its own statistic. But
yeah, great point, and interesting. I didn't know that about the Bulgarian government saying, "Hey, we don't do that type of analysis; it's forbidden." And so, but recognizing we all see something disproportionate. So, Deborah, good eye. Alitza and Tony, thank you so much for your work today and sharing so generously the research that y'all have found. Dr. Tony, thank you for your presentation as well. I'm enlightened and motivated. I feel like I'm texting my friends of like, I love this group. I think we need to continue doing stuff together to try to figure like, what does this mean in action? And we're going to find it together. My friend Sydney is going to post in the chat right now the link to our eval form. It's only 9 questions. It may take you less than 60 seconds. So we're going to spend 60 seconds right now filling out that form. As it comes through in the chat. And then the reward for doing that is to take a screenshot of everybody that's here. So take 60 seconds in silence, evaluating this event just briefly. What to expect next? There's a follow-up email that'll have a lot of information in it. Feel free to read that, peruse that, share it with your friends. The collective at A Child's Hope Foundation is constantly having these events, whether they're for Bulgaria and Eastern Europe or our work in Africa or in Latin America. We're excited to continue to create collective action together. If you're not a member of the collective, there will be an invitation in the follow-up email to join. It's free membership. We're just trying to bring the right people to the right table at the right time. There will be more events specifically for this community inside the collective working in Eastern Europe. Because y'all came to this event, we'll have your emails and we'll make sure that you're informed as we move forward. Thank you so much for being here. It means a lot and we're excited to do more good together.